This segment is sponsored by Virginia Physicians for Women.
We're exploring the first steps to take for a healthy pregnancy. Dr. Erica Royal joins us this morning. It is great meeting you and great talking with you before we even got to talking.
So nice to talk with you too, Jessica.
It's the time of year, 'tis the season, springtime. We get heated up, get excited about things, and there may be some couples or families or individuals thinking about getting started with pregnancy this time of year.
You're exactly right. I think in this season of new beginnings, a new baby is a new beginning for a family. It's a short period of time with an extraordinary result. And there are just some simple, easy things that people should think about if they're thinking about becoming pregnant or if they are pregnant.
Because it's a whole new world in terms of taking yourself or being with your partner on this journey.
It is, it is. One of the biggest things to think about is just get healthy even before you conceive. And that goes for mom and dad. If you have any health problems that you're being treated for, meet with your doctor, get those under control because they can really have an effect on the pregnancy. Certain medications can have an effect on not only pregnancy, but on conception for mom and dad. So it's important to be in your best health before you start the journey.
Yeah, I started walking and lost 10 pounds before getting pregnant, which really made a difference in the pregnancy.
And it does. Exercise is so important for pregnancy, and ideally, the way you embarked upon your journey is great because if you start an exercise regimen before you conceive, before you're pregnant, it's a lot easier to continue that exercise regimen and it's a lot safer. If you're going to start a new exercise regimen once you're pregnant, you really do need to consult with your doctor. There are even studies to suggest that a woman who exercises during pregnancy decreases the risk of her baby having cardiovascular disease in his or her lifetime.
Wow.
Is that not amazing?
That is amazing. So really setting the stage for yourself and for the future of
lifetime
your child,
health,
which everybody is hopeful to do. Another very important thing that I felt like I was kind of learning on the fly is that there's a schedule for things. There's prenatal care that you need to get familiar with.
There is. And early prenatal care is so important because the earlier you start, the more information we have about your pregnancy, the more we can intervene for subtle things that may come up. But also, you gain a partner who is invested in your health and the health of your pregnancy. That would be your doctor.
Yeah, that's very, very, very important for sure. We talked about the exercise. This was really key too in helping with getting proper maybe rest and yet having energy.
Yes, your body is changing so much, and people know that once the baby comes, rest can be limited. But when you're pregnant, there's so many physiologic changes. Your heart is pumping more blood. Your body is carrying around a baby. Your kidneys are working harder. So your body really needs that time to rest. And then it is a time of hormones. And rest helps to manage things like mood symptoms and some of the other changes that hormones can cause.
So in a way, these are common sense things that you want to be doing before you maybe get pregnant,
yes,
during your pregnancy, and then continue after.
Yes. Some ladies, they tend to burn the candle at both ends, and they feel almost guilty if they take the time to exercise, rest, eat well, drink water. Water is so simple, but it's key. The amount of water we drink is linked to the amount of fluid we make around the baby. Also, there are certain parts of pregnancy that if you don't drink enough water, you can have premature contractions. And if you don't drink enough water, you can have swelling, which then contributes to discomforts and things like that. Like I said, it's a short time to pay really good attention to your health and the health of your baby to have a beautiful long-term result.
What about a strategy for vitamins?
Yes. Prenatal vitamins. There's so much work that goes into the development of prenatal vitamins, and there's so many choices. Now, the vitamins you can buy over the counter in the grocery store or the drugstore are just as good as the prescribed vitamins. My favorite prenatal vitamin, I'll share this secret with you,
Okay.
is the one you remember to take every day.
I thought we were in for a super hot tip, and we were. That's a good one, yes, because that's critical.
It is. It is. Don't get caught up in the different choices. Pick one that you like. You may need to try a couple, but stick with it. You'll take it through the pregnancy and even after the baby's born, and you are already getting a jump start on your health and the health of the baby.
And you mentioned, you know, a lot of women and couples burning it at both ends. Yes. We're almost out of time here, but this is a time that you want to be able to really cherish.
Yes.
And that's part of the experience.
Yes. Most families will only experience pregnancy a few times in a lifetime. And it's only 10 months. People are used to hearing 9 months. 10 months in order to achieve a great long-term result. Cherish that time, and pregnancy can be fun.
Yes, it can be.
It can be.
It really can be. Thank you so much for being with us, Dr. Royal.
Thank you for having me, Jessica.
Nice talking to you very much. Virginia Physicians for Women has 6 convenient locations throughout the Metro Richmond Tri-Cities area. They are all over the place. 897-2100 or visit VPFW.com to get connected with the location closest to you and get started on this journey. We're going to send it over your way.